Now, next, he's a Canadian emergency room physician who worked for 16 years at the Red Deer Regional Hospital, where he served as Chief of Emergency Medicine for the Central Zone and head of the Emergency Department from 2016 to 2020. He holds the title of Associate Clinical Professor at the University of Alberta, and he led Alberta's COVID-19 pandemic response data review task force, which examined the pandemic's health data. His report released earlier this year and recommended against the use of COVID-19 vaccines, setting concerns over safety and efficacy, and has called for a public inquiry into the province's pandemic management. Please welcome Dr. Gary Davidson.
To sing, so I'm not going to sing with that. Thanks, you guys, but I'm in a church behind a pulpit with a mic. I'm going to have an altar call at the end here. You've heard a lot of information, Dr. Rancourt and Dr. Speaker, and you're going to hear from Dr. Bridle later, and then some others you've heard before. When we were doing our report, we had the opportunity to talk to all these guys, some of them more than others. And I can tell you that they're the smartest people I know in what they're working on. And it was a real privilege to work with them, and their information is in our report. And I can never give it as well as they did, so I'm not going to try. I had the privilege of being asked to write a report for the Premier to look at the information and data used in Alberta's response to COVID-19. And it's not an inquiry, it's not a witch hunt, it's just a review of the data used. So where did the data come from? So we had some criteria, where did it come from, who resourced it, who gave it to us, who analyzed it, who applied it, how was it applied, and did it work the way we thought it would? Or do we have any recommendations to do it differently, or different later? And so that's what we did. We sat down and inside of that parameter, we looked at 9 specific areas of our response to see if we looked at it that way, what results do we come up with? So we looked first, governance and data flow. And I know most of you have seen the report, and it's probably, yeah, there's the front page. And so I'm not going to go through it, because you can read it. It's only 259 pages, and there's a lot of reasons. I don't understand why you're laughing. I had to read it about 100 times, so you guys can read it once. So, yeah, it's a little heavy. But you know, the first one is, how did it happen? How was it set up? What are the structures needed for the data to flow the way it did? Where was the data coming from? Who's using it? Where did, you know, how'd that all work? And it's a little bit, it's not a juicy chapter, but there's a lot of really good information in there. It tells you a lot. And then we had a one on regulatory bodies, which is, you know, our governing bodies, so the College of Physicians, Surgeons, etc. And what role did they play? And everybody knows a story of some doctor somewhere who got a little trouble for saying things they shouldn't in front of people sometimes. And, you know, how did that happen? And so in a profession, there has to be a regulatory body. You can't just go Wild West on everything. So it has to be. So we need them for sure. But did they do what they needed to do for the best of the people, or not? And so that's what that chapter looked at. And yeah, so read the chapter. It's the shortest one. I think it's only 71 pages. But it's really well done, and it actually was 91 pages, and I got told it needed, well, my idea when we were writing the report, I wanted each chapter to be 10 pages. So I figured it'd be a little under 100 pages. And so when it came in at 91 pages, I said, we got to pare it down. So somebody ran it through AI and got it down to 15 pages, and it didn't make any sense. So we ended up at 71 pages. That's as short as we could get it. Because it took that much to explain how this all happened. And so there's some really interesting charts in there, and probably the number one chart in that one, and the only data I'll give out of the report, that is that only 2% of the information they use to make their decisions on how they discipline the disciplines, only 2% was primary research. The rest came from looking at other people. And it's in the report. You can look at it. It's just factual. So I'm not sure how, that's not quite the way I would do it, but whatever, that's how it was done. So every chapter we have recommendations. So this is what happened, this is how it was done, we didn't look at why it was done. I wasn't looking at motives or who did it. It's just how, and then what recommendations we make so we do it different next time, if it needed to be done better. Then we had a chapter on modeling. So you saw Dr. Rancour was just talking about Teresa Tam's, or Dr. Tam's modeling, how 1 million people were going to die if we hadn't done what we did. And it's just nonsense. And it's right up there with there's going to be no polar bears by 2012. Remember that was said in 2000? Yeah, same model of modeling. So but modeling, it is hard to be too critical of modeling because it's like a weather forecast 2 years ahead. You know, I have no idea if it's going to rain on Saturday 2 years from now. So I understand, we'll give them some grace, but when it looks like you say one thing all the time, then you start to question their motives, and that was part of that. Then there was testing, and we had some pretty amazing people. I think Dr. Speaker helped us in that chapter quite heavily, and just, you know, world-class people helping us on this stuff. And recommendations, you know, was the testing used right? All that. I always forget a chapter every time I do this. Not the one I wrote, but somebody else's, and I really apologize. And it's a different chapter every time. That's a good part, so nobody feels left out. But then we had natural immunity, or there's no real such thing. Well, there is natural immunity, but we mean infection-acquired immunity. So you got COVID, and now you're immune, or are you? And so we did quite a bit of work on that, and Dr. Rydell and Dr. Speaker both helped a bit in that, or a lot in that. And so I would ask a vaccine immunologist that before I would ask an emerge doc, how does this work? And it was all very downplayed. Oh no, you're much better off doing something else rather than using your natural immunity. Or it doesn't count for getting in a hockey game or on an airplane or crossing a border. But in fact, that wasn't true. And so why? It's hard to know. But what can we do so this doesn't happen again? And what information were they using to come up with their conclusions? That's what we looked at. So it's in the report. Vaccines, so we've heard a bit on vaccines today, especially from Dr. Speaker, and how he thinks they really worked. And Dr. Rancour was just saying every time a vaccine rolled out, it looks like we killed a bunch of people. Yeah, it sure seems like it, doesn't it? And these are world-renowned researchers saying that, so I tend to think that they probably are right. And the last chapter is therapeutics. What treatments were we allowed to use? What treatments couldn't we use? And it was the same thing again. You know, where were they getting their information? We couldn't use certain medications because they're really deadly. Like so deadly that if you took all 30 days worth in one day, it wouldn't hurt you. That deadly. But if I give you the Tylenol for your fever, you come to emerge and all I give you is your Tylenol and say, well, I hope you don't die, but go home is what I'm going to give you Tylenol. If you took all 30 days of your Tylenol at one time, I won't see you in 30 days. Or Advil, or aspirin, or Benadryl, or anything else you could buy at 7-Eleven, including chocolate bars. You know what I mean? There is a lot of things more deadly than ivermectin. It just, I did not understand. Well, I do understand it, but so I prescribed ivermectin hundreds of times, and I wasn't giving people horse paste. I was prescribing it from pharmacies. And we prescribed it all across Western Canada. And we had it FedExed them if we needed to. And it worked very well. And I didn't get anybody that clogged up the emergency department, as the Rolling Stone magazine said happened in Oklahoma, which was a completely fabricated article. But again, people listened to this, and then the media would play it over and over. So then we looked at medications we were told to use. And it was like, wow, like, one that was brought out for AIDS in the 80s that killed too many people, so they quit using it. Then it resurrected, somehow good for COVID. But then they used the licensee's brochure, it's like their sales brochure, to tell you it's okay. It's like, that was confusing. So we just showed it. We just showed the information. We weren't telling motives. We weren't telling why. Just, this is what happened, and this is how it happened. And so one of our big recommendations is we need to find out why. And that would be an inquiry. That's where you get lawyers and judges and subpoenas, and you got to show up and tell the truth. And that probably would be a good idea, because it'd be interesting to know why. But that's a recommendation. There's a lot of recommendations in there. You can read the report, and there's a whole bunch. And people are, coming to me all the time. When is the government going to do something about your report? When are they going to implement it? I says, well, what do you mean by that? So there's been laws changed, there's been policies changed, there's laws and policies going to change. We're working on things as we speak, and a lot of the recommendations don't have to happen in a ledge. And the government, you have to understand our government, and I really appreciate our government. You have to remember that this government asked me to do this. And this wasn't very easy, and they knew it was not going to be all roses, but they still asked me to do it, to assemble a team to do it. So before you get too hard on them, remember they're the only ones that have done it so far, at all, that I can see anywhere. So remember that part, that they did it. And you have to remember that not everybody agrees with it. And so it takes a little while for everybody to digest it and figure out what we're going to do with it. So we have to understand that. It's a big ship, about 5 million people, and you can't just turn it on a dime. You can't change everything overnight. And you can't just throw everything out and start over. It'd be pure chaos. We don't want that either. So we have to understand, to some degree, that we have to have a little patience. It's good to keep talking about it and pressuring it and like this, sharing about it. I think that's really important, and I'm not downplaying that. But we have to understand that they're still governing all 5 million people, and they don't all agree with us. And we have to work with everybody. So yes, they are. So I appreciate that, but we have to understand how it works. And moral of the story is, I wrote the report, I handed it to them, they get to implement it the best they know how. And it's good to keep on it. But I'm going to tell you that really the problem we had wasn't COVID, and it wasn't a vaccine, and it wasn't lockdowns, and it wasn't masks, and it wasn't all the things we thought ruined our lives. The problem is it happened because we let it happen. And you can blame the government, and we can pitch to change the government if you really feel obliged. It's not going to help the problem. We're just going to have a different government, same problem. So whose problem is that? That's our problem. And so why did it happen? It happened because, well, it was a difficult choice sometimes to do what was right at all costs. And not everybody is able to. I can imagine probably most people in this room probably did, if you're here. Not everybody, and some people maybe saw it later, and that's amazing. But we weren't willing to sacrifice what we thought was really important to us for what we knew was right. But we're asking the government to do it right now, at all costs, just do what's right. But then, did we? Did I do the right thing all the time? And I'll tell you a little story. Before COVID came to Alberta officially, it was coming out, and I was reading everything. I peer-reviewed for a journal for a number of years, so I know how to read a medical journal and know when it's full of baloney and when it's not, and a few things like that. And so I was reading this stuff, and it was like, man, it's just really troubling. This is a lot of nonsense and very little science, and there's some real bad stuff going on. And not only that, there's some medications that look like they help. You have to remember that ivermectin, hydroxy, and all those things were studied against SARS-CoV-1 like almost 10 years before. So it's not like we just dreamt it up in one afternoon. We knew this stuff, and it was like, well, let's do this. Let's get on this, and let's treat people. And I started to have a lot of questions about it, about our approach to it, about the fear was just amazing. How can we be gripped by the fear? Why were we susceptible to the fear? And that's a real question. Because if you're susceptible to fear, that means you don't have any faith. You can't have both. You have one or the other in an area. So it means we didn't have much faith. And we didn't have much faith in our government often. And we all feel like that. But how about personally? How about what was our lives grounded on? So as we went through 2020, and nothing happened. I shouldn't say nothing happened. The emergency department where I worked went down 30%. We had 30% less visits that year than the years before. And I'm thinking, where's this thing? Like, where's this thing coming? So we actually had to let one doc go home every day because we didn't have enough work. And, so I was thinking there's something not quite right. And then 2020, we started watching this vaccine get developed, and I'm reading this stuff, and I'm reading Pfizer's data, and I think there's huge problems with it. They didn't vaccinate, in the study, they didn't vaccinate anybody under 18, anybody over 65, anybody sick, or anybody's pregnant. Wow, that's nobody that needs it. That made no sense. So, and then when the stuff was released, there's 44,000 people in the study, 22 in each arm. And there was more people that died in the vaccinated arm than the non-vaccinated arm. You're done. Any vaccine, because we don't know what the side effects will be. So if the all-cause mortality in the vaccinated arm is higher, in any vaccine study, we're done. So that was one thing. And I was like, wow. Well, turns out 272 girls did get pregnant after they got vaccinated in the follow-up period, and they lost 88.7% of the charts. They didn't lose 88% of everybody else's charts. Why did they lose their charts? What happened to those girls? Where'd they go? That was weird. And it's not like they're old and should have died and we just lost them to follow-up. They shouldn't have. They should have been fine. But they didn't lose, 38 charts. And out of those 32 charts, there was one normal birth. That's not a good number. I don't care what vaccine you're doing. And I had that in 2020. And I printed it off at work and I highlighted it and I'm showing people and I got in trouble for causing vaccine hesitancy. I'm like, no, I just think this is not a good idea. We need to talk about this. And I thought, okay, there's something really bad because everybody should say, whoa, stop. Why aren't we? And so in 21, when it became apparent that sooner than later I wasn't going to have a job if I wasn't going to take this vaccine, you could just feel the pressure coming. We actually snuck across the border, and I can't tell you how, but we drove. And thanks to my wife, actually. She phoned the American border every day for a week. Okay, what if we do this? Can we get across? No, you can't. What if we do that? No, you can't. What if he has a doctor's appointment? No, you can't. What if he's a doctor? I don't care. We did find a way, and we won't tell you how, but it had something to do with buying farm equipment in the States, and farmers could do anything. So that afternoon, I packed up my truck and I drove to the border as fast as I can. We asked him if he was still on duty, and he said, I'll be there before you quit. So I zoomed to the border, and I get there with all my paperwork, showing that I owned the farm, I owned the truck that I was driving. I had an order of something I'd ordered in the States, and I get there. Well, that was actually pretty funny. I was really nervous because I thought, I'm going to jail somewhere. And finally, this really nice American border agent calls me. They'd made me go in, and she calls me up and said, your Nexus card's expired. It's, my wife put the wrong one in my passport. And she said, did she dress you? Like, what does your wife have to do with this? And then this guy behind her said, you're a complete nutcase to even try this. And it was the guy she'd been phoning all week. Anyway, he says, see you later, have a good trip. He thought it was funny. Anyway, we got across the border. That was one of 5 times we snuck across the border. We did it every way, any way, and any time we could. It was a challenge. But the moral of the story is we went down in March 21. Dr. McCullough had testified before the Senate March 11, 12. And so I watched this, and he said, if you do this and don't lock down, we can drop your hospitalizations by 85% in 4 weeks. And I thought, I'd like to see this. Because we just locked down, if you remember, in December 2020. For Christmas and all that stuff, and I didn't think it really did anything. So we went down there. We were in Texas, driving and flying and in the mall and wherever we wanted to be, in the restaurants, and people wore masks if they felt or they didn't, and nobody cared. And I'm watching the dashboard on, the Texas government dashboard, and I'm watching the hospitalizations drop. They dropped by 89% actually in 4 weeks, not 85. So he actually underestimated. And I'm thinking, we're done. Like, quit all this nonsense. It doesn't have any impact because these people are doing whatever they want. There's no lockdown. I'm here. Trust me, it's not happening. We drove across the border April 9th, 2021 as we got locked down. As we were driving into Cardston, it was on the radio, we got locked down. It's like, come on, you guys. Anyway, got me in a little trouble. But I'll tell you what really is the story is when we're driving home, when we were down there and I talked to these doctors that were treating people, and I realized what I thought was true. And I, as a Christian, if you come in and I think you could die, and I don't give you something, and I say, I'm sorry, there's nothing I can do for you, and I know there is, of all people, I'm the worst. Like, I don't know, that's a problem. But you see, if I did, then I was going to lose everything. Because they take my license away, and Walmart wasn't hiring, and I have no transferable skills. So, we had 2 kids in university in the States, and I have lots of overhead and all that other stuff. And we were driving just north of Helena, and my wife was with me. She snuck through too. So anyway, we're driving home, and we're talking about this as we're talking to these doctors in the States that are treating people, and they got protocols, and I'm reading it, and they're sending me the papers, and we're driving, and I said to her, I can't not treat people. I can't go home and tell you to go home from Emerge. I hope you're okay. Here's some Tylenol. Don't take it all. They'll kill you. But just take a little bit, and I hope you feel better. And if you get worse, come back. We won't do anything for you, but we'll admit you. I can give you some remdesivir if you don't. Anyway, so, but I said to her, I says, I can't not treat them, but if I do, we're going to lose everything we have. Like, we will lose it all. And she said, it's okay. I'll tell you, you can't do it by yourself. It's a hard thing to do. And yeah, so I appreciate that. So we drove across the border, and Jason Kenney was on the radio locking us down before we got to Cardston, and then we promptly drove to another minister's office that we knew quite well, and we sat in his office for 2 hours, said, what are you guys doing? Like, I'll fly you guys to Texas, let's go look, like, promise you I was there. And it just wouldn't happen. And I talked to everybody I could, a number of ministers and everybody I could, and we just never got any traction. So I started treating people. First person I treated was really, really sick. And I was really, really scared, because I thought, oh boy, here we go, we're starting on this path, and this will be the end of me being a doctor. So I drove to his house, because I didn't want to do it on the phone, because anyway, paranoid, to say the least. Ordered him a whole bunch of stuff, and told him what to use, and this guy, and that, and the other thing. And he was I actually had to order him oxygen, like he was very, very unwell. 18 hours later, he phones me, says, Doc, I could go to work, I'm fine. And he says, why aren't we doing this everywhere? And I don't know the answer to that yet. I don't know. But I can tell you that I told so many doctors this, and they said, I just can't do that. I said, why? Well, I'll lose it all. I said, so you're okay telling people to go home and die so you don't lose your income? That's how come this happened, right? Because we needed courage and we didn't have it. So the report is good, and the government's important and all that, but it's us. We have to have courage, and we have to stand up at all costs. And I'm going to tell you, it costs us a lot, an awful lot. We're okay. But when it costs you a lot, what I don't want to hear, you'll whine the whole time. Because you said, at all costs, I'll do what's right. And just understand that sometimes you got to pay that. And that's just the truth. So Sean's here to get me.